Hubert Humphrey said it best, that there is a moral obligation, in my opinion, take care of those in the dawn of life, the children. S. Chip. And you know we disagree on that. I voted for it, contrary. There are those who, we should take care of those in the twilight of life, the seniors, and those in the shadows of life, the sick, the disabled, the handicapped. I do believe that. But in this case, moral is good for our economy if we get the competition fair once more. We saw what happened, however, when you let companies or corporations determine the rules. That's what we did in Wall Street. We said, you don't need regulation, figure it out yourself. Now look at your IRAs and your 401s as they just flip-flop back derivatives. Take Pennsylvania. There's 2 large corporations that have 70% of all the private health care plans. It's like OPEC. It's like a cartel. And they can dictate a price. In fact, imagine being an individual going up against one of those 2 corporations for a fair pricing. So what we do is say, keep your health care plan. But we're going to put another health care plan out there. Call it whatever you want. It's not going to be subsidized by the U.S. government, however. It's going to be like Blue Cross Blue Shield was 5 decades ago. It is actually going to have to live or die on the premiums, the co-pays, and the deductibles of those who elect. You don't have to, but elect to join it. And only those in companies with less than 50 employees or individuals can elect to join it, or join any other private health care plan out there. The difference of this public option, public because Joe Public can join it as a choice, is that we're not going to pay $20 million salaries to the CEO. Last week, a woman came into my congressional office. We keep our office open 7 days a week. She came in. Back in January, her payments went up $29.10. She paid the rest of her bill in January, but in this recession, didn't have enough to pay for that 1 month alone, the $29.10. She paid the full amount in February, March, April, May, June, July. She went to the hospital for serious treatment in July, and the insurance company denied her treatment because of that $29.10. It's called rescission. And what you have in the insurance companies is where they hire accountants that when you go in for treatment 10 years later, if they find an administrative problem on your application, and sir, you're right, it's not the hospitals. They don't deny coverage, but they deny you coverage for technicality. We forbid what's called rescission. We have handled a young couple who came in with a young boy, stunted growth, and the insurance company denied it. The doctors recommended hormone treatment so it could grow, and we had to roll in and ask them to reconsider, which they did. So we do set, not rationing. We do away with rationing. The rationing that says you cannot have health care if you have a pre-existing condition. The rationing that says, look, we're only going to do these types of screenings. And so what we do is say there's just a minimum level. Do more if you want, have more choices, but every healthcare plan will have to have the same requirements that congressmen and women get, period. Let's talk about the $1 trillion. I wasn't in Congress when Pat was, and if you don't mind, Pat, I think just to make sure we can compare, I really liked what President Clinton had done with the Republican Congress, to where they had 3 consecutive budgets that had surpluses because they had a pay-as-you-go agreement. And then Congress, in 2001 with the Bush administration, voted to get rid of it. And that $4.5 trillion debt, as you were in Congress, well, by the time President Obama took over, it was $11 trillion. It's pretty hard to splash water when you're the one who put it in the bathtub. That's a lot of debt. At a young boy, 6 years old, through malpractice somehow becomes a quadriplegic. And that we should recover, as you said, his livelihood that has been lost. But that boy will never go walk again, go to the bathroom by himself again, or put his arm around a girlfriend at 18 years old. And I don't think it's incorrect to say you should have your day in court. It's what the Constitution says. I don't want the government to intervene and think the government is wise enough to say it should be $250,000. I want a jury of your peers to decide that. What we need in the future is principled, accountable leadership.